Well, the African Center for Disease Control had issued a warning to African countries against the commercial importation of COVID-19 vaccines. This revelation sheds light on a situation that could have easily been avoided by the Kenyan government had it followed Africa's CDC's advice. Now the Ministry of Health finds itself in a classic situation of putting the cart before the horse in regards to the Russian Sputnik V vaccine. Gina Kirori has the details.
The Kenya Medical Association becomes the latest institution to call out the government for the commercialization of the Russian Sputnik V vaccine. While the AstraZeneca vaccine is offered for free at health facilities, the Sputnik vaccine retails at 8,000 shillings per jab, totaling 16,000 shillings for the 2 doses required. This cost is not only far beyond the means of most Kenyans, but also far above the global cost. In its statement, KMA says that the commercialization of the Sputnik V vaccine has locked out many Kenyans from accessing the vaccine, contrary to an earlier assurance that all vaccines would be available to the population for free or at a small surcharge fee. It adds that this has set a dangerous precedent that can result in the vaccines being priced out expensively and leaving out more than 40% of Kenyans who live below the poverty line. It is now emerging that Africa's CDC had warned African governments against commercially importing vaccines because doing so would widen the poverty gap. But the Ministry of Health still went ahead to procure it in what has become a web of confusion as to who is calling the shots on the COVID-19 vaccine.
It should not be allowed to be given to the private sector because vaccines are very scarce globally. And as soon as we remove our ability to negotiate together, the prices will go up.
In the days that followed the controversy, the ministry appeared to talk tough.
There will be no licensing of private players in the importation of vaccines.
The seemingly knee-jerk response, however, offers little on the way forward in terms of other vaccines that the Ministry of Health stated it will consider importing into the country in future, such as Johnson & Johnson. Meanwhile, CDC says African Union has not yet granted emergency use authorization of the Russian Sputnik V vaccine, as it is still observing data on it. And as the AstraZeneca vaccine rollout continues, KMA has also castigated the ministry for the haphazard manner in which a vaccination drive has been handled over the last few weeks, arguing that most of the targeted people under Phase 1 have been left out, including senior citizens, and vaccinate as many people as possible quickly, especially the most vulnerable groups. Gina Kirori, NTV.